Stimulants. These drugs increase brain and nervous system activity, leading to heightened alertness and energy. Common stimulants include cocaine, methamphetamine, and prescription drugs like Adderall and Ritalin. They increase dopamine and norepinephrine levels, enhancing concentration and energy. However, they also raise heart rate and blood pressure, with high addictive potential, often leading to serious cardiovascular problems and mental health issues like anxiety and paranoia. Depressants. Opposite to stimulants, depressants slow down brain activity, leading to relaxation and drowsiness. Alcohol, benzodiazepines like Valium and Xanax, and barbiturates are well-known depressants. These drugs enhance the activity of GABA, producing a calming effect. While useful for anxiety and sleep disorders, they carry risks of overdose and dependence, particularly when combined with other depressants or alcohol, potentially leading to respiratory depression and death. Opioids. These drugs are primarily used for pain relief, including prescription painkillers like oxycodone and morphine, as well as illegal drugs like heroin. Opioids work by binding to opioid receptors in the brain, reducing pain perception and producing euphoria. Their high potential for addiction and overdose is a major concern, particularly with risks of tolerance, dependence, and respiratory failure during overdose. Hallucinogens. Hallucinogens alter perception, thoughts, and feelings, often causing users to see or hear things that aren't there. Examples include LSD, psilocybin or magic mushrooms, and PCP. These drugs primarily affect serotonin receptors, leading to altered sensory perceptions and hallucinations. While not highly addictive, their unpredictable effects can lead to dangerous behaviors, psychological distress, and long-term mental health issues like persistent psychosis or hallucinogen persisting perception disorder. Cannabis or marijuana contains the psychoactive compound THC, which produces relaxation, euphoria, and altered sensory perception. THC interacts with the brain's endocannabinoid system, affecting memory, concentration, and coordination. Though less addictive compared to other drugs, long-term use can lead to dependence, cognitive impairment, and mental health issues, especially in young users whose brains are still developing. Nicotine, found in tobacco products, is highly addictive. It stimulates dopamine release, creating pleasurable sensations. Despite its legal status, nicotine addiction can lead to serious health issues like heart disease, stroke, and cancer. Quitting is challenging due to withdrawal symptoms like irritability, anxiety, and strong cravings. Inhalants. Inhalants are substances that produce chemical vapors, which can be inhaled to achieve a mind-altering effect. Common inhalants include glue, paint thinners, and nitrous oxide. They cause immediate effects like dizziness and euphoria, but are extremely dangerous, potentially leading to sudden death, brain damage, and organ failure. Inhalants deprive the brain of oxygen, causing irreversible damage. Dissociative drugs. Dissociative drugs, such as ketamine and dextromethorphan, DXM, cause users to feel detached from reality. They disrupt the action of glutamate, a neurotransmitter involved in perception, emotion, and cognition. While used medically as anesthetics, recreational use can lead to addiction, memory loss, and severe psychological distress. Synthetic cannabinoids. Synthetic cannabinoids, like spice and K2, mimic THC, but often have unpredictable and severe effects. These substances can cause extreme anxiety, paranoia, hallucinations, and life-threatening conditions like heart attacks. Their varied composition makes their use particularly risky. New psychoactive substances, NPS, often called bath salts or legal highs, are synthetic drugs designed to mimic the effects of existing illicit drugs. They can have stimulant, depressant, or hallucinogenic effects.